Hey, welcome everyone. Is it Monday, I think?
I
I
think
think we
it's
made it back.
Tuesday.
I was like, what day of the week is it? Welcome back to our series for the month of June, called MHAM, and that stands for, I should actually put a quiz out and see how many people have caught on now to what it stands for. So Migraine Headache Awareness Month, and we are so excited that we have offered some fantastic sessions this month so far. And today we start a new series, and we're going to talk about misunderstood. And what that means for a patient who has stigma, it really feels the stigma of having migraine. And so we're going to talk about that with Dr. Dawn Buse. And Dr. Buse, thank you so much for joining us. Can you give a quick introduction of yourself?
Absolutely. Thank you, Carrie. Hello to all of our listeners. I'm Dawn Buse. I am a clinical professor of neurology at Albert Einstein College of Medicine. I'm on the board of the directors of the Headache Cooperative of the Pacific, and I'm a licensed psychologist. So I've been working with people with migraine, other headache diseases, and other chronic conditions for about 2.5 decades now. Both as a researcher, where I have the privilege of collecting massive amounts of data along with my colleagues, one of my primary colleagues being Dr. Richard Lipton, um, as well as a psychologist where I get to meet with people one on one or with couples or with families or in small groups and really talk about life with migraine and living your best life with a chronic, unpredictable, painful illness such as migraine or another headache disease.
Yeah, well, thank you. I think that really is very clear to people why we would have had you join us today for this call with your background. Let's just start at the beginning because in the conversations I have with advocates and patients, and we talk a lot about that people don't realize that there's stigma in migraine. What are we talking about and what is this? What is stigma?
Stigma is being discredited, disvalued, or pointed out in a negative way for any particular condition or disease. It could be a little girl with red hair who feels stigmatized because she stands out and is unusual and different. So it can be a physical attribute. It can be a medical or psychological disease or condition. It can be an invisible disease or condition such as migraine. It can be many other types of variables, but it's a specific variable that maybe the individual perceive certain things about themselves, and maybe society and others perceive certain things about individuals with that characteristic.
Okay. And are there different types of stigma?
Absolutely. Yes. There is that internalized stigma where the individual themselves feels negatively about themselves having this. We're going to talk about migraine. So, having migraine, they may feel guilty themselves. They
Hmm.
may feel embarrassed. They may feel less than, less worthy. And then there's quite a few types of external stigma coming from the outside. It can be structural stigma. So it can be coming from large groups like the government, like who is allowed to receive accommodations or disabilities, which diseases get research funding. It can come from insurance payers, what is covered, what's not covered. It can also come from people's individual life experiences, like the workplace with their boss, with their colleagues, family and friends, and everywhere in between. So, generally, we'll probably talk about external versus internal stigma, and often they go together quite a bit.
Yeah, I think when you said the fact that it's being discredited, I think that kind of resonated with me. I felt that to my core from conversations of people saying, I just feel like if I don't press through, people are going to discredit me and not understand that I really am in pain. I'm really struggling. So I really, really like that word. You have experience with, you talked a little bit about your bio, but you've had experience as a psychologist, an advocate, a research scientist, and there's a lot of research around migraine stigma. Tell us about that.
There is, and that's really validating. It's the opposite of feeling discredited and disbelieved, is validating that now we've done quite a few large studies. And in fact, Dr. Bob Shapiro started quite a while ago with this idea, along with Dr. Bill Young. They really started looking at, did people with migraine feel stigmatized themselves, and were they treated in a way from all these other agencies and organizations and individuals that was stigmatizing. They really laid the path. the groundwork. And then after that, we developed the Overcome study, which was a study of 60,000 Americans with migraine and another 100,000 people without migraine, which was very interesting. I'm going to tell you why in just a minute. And we assessed migraine-related stigma in those individuals. And we actually developed a survey questionnaire from the Overcome study and found that there were two types of stigma people were feeling themselves. One is that they were not believed about how disabling a migraine attack is, or even between symptoms. And the second is that they got the impression that people believed they were using migraine to get out of responsibilities. So we call that part secondary gain. When we surveyed 60,000 Americans living with migraine, about a third of them felt these feelings of migraine-related stigma often or very often. And that matters. And we'll talk about that why in just a minute. So migraine is common for people living with migraine. It's also common to feel that stigma coming from other directions. It was really interesting. We did ask those 100,000 people without migraine, do you believe these 12 things about people with migraine? And we did see quite high rates of stigma amongst people who currently didn't have active migraine, including people who had previously had active migraine or had people in their lives close to them with migraine. They did have those stigmatizing beliefs. So we saw kind of a complementary, depressing, sad, but complementary validation of what the individuals have been feeling, as well as what was coming from kind of externally.
I love that. And as people are watching now or watching this later, I would love for people to feel comfortable putting in the chat. Certainly don't feel like you have to expose yourself, but if they want to put in the chat, they can
Yeah,
relate to this. I think so often we need other people to speak up and say, yes, that's exactly how I feel, to really try to start breaking that stigma. I mean,
absolutely.
yeah, yeah.
And a lot of people listening are either self-advocates or becoming advocates. And one thing you can always do is all of our research is open to anyone in the public in the world. All you have to do is go to the website PubMed, PUBMED, and type in migraine and stigma, and you'll see these studies come up. You can always read the abstract, which tells you about the study in 4 or 5 short paragraphs, and many of them are also free. And we, of the Overcome study and other studies I've worked on, have ensured that they are free to the public. So you can just read about it yourself and really go into the details and see all the things we measured and all the outcomes if you'd like to learn more.
I love that. We'll make sure to put the link to that in our chat as well so that people can see that. And that's just a good reminder. Of course, we don't want people to go and print it out and put it on their kitchen table and say, see, look, I told you this is real. But I do think there's the right way to help express that and share that with their loved ones, because people sometimes say those closest to them don't always believe how hard this is. Uh,
Absolutely.
so thank you for
Absolutely.
your work on that. Let's focus on the external stigma you talked about earlier. How common is it for migraine patients to feel dismissed by their healthcare provider and their loved ones?
Unfortunately, both of those are common. And we found that in surveys of people at clinics in New York City, we did some clinic-based surveys. And then I got to work with some folks who were doing a advocacy study around the world, the European Headache and Migraine Foundation, which is a kind of sister organization to American Migraine Foundation. And people from around the world said about a third of respondents said they had felt stigmatized by their healthcare professional, the person who's there to help them. Now, that might happen for a lot of reasons. So, to kind of reset our level here, of the people with migraine, so about 1 billion people in the world, about 40 million Americans, only half even mention it to their healthcare professional. And that could be for a lot of reasons. It might be stigma related. And in fact, we really think it is to a great extent. And we found that in some of our research. Of those who do talk to a healthcare professional, they usually start with a primary care professional. And someone might come away from an interaction with a primary care professional feeling that they weren't listened to or heard. There could be a couple reasons. One is if it's at their annual visit, primary care professionals do have a mandated list, quite a few things they have to get through in a short visit, in that 15-minute time slot or 12-minute time slot, however many minutes it is. Not a lot, and it's a long list. So often to talk to a primary care professional, the best thing is to say, I need to talk to you about headaches or about migraine, and they'll probably want to set a separate appointment. So that's one reason people might have felt that their primary care professional focused on other things and it wasn't what they wanted to talk about. So it's often great to have that second appointment. Often, as well, they may be talking to a healthcare professional that it's just not their expertise. They try as they might, they have a lot to learn about a lot of things, and it's hard to keep up. We've been trailblazing like crazy in migraine the last 10 years with all sorts of new treatments, pharmacologic and non pharmacologic, great advances in our knowledge and our science. But that's really the headache experts. It's all of us who spend our lives in migraine and headache. We can't expect people on the front line, our primary care providers, our OBGYN, our pediatrician, to know everything about everything. So also, they might be your first entry, but they may want to refer you on to, it could be a neurologist, it could be a headache expert, or it might be another primary care type or internal medicine type of person who is more migraine or headache disease knowledgeable and interested. So you might need to find the right match. And so I really encourage people, if you felt blown off, if you felt dismissed, not believed, not heard, one, totally happens a lot. And I can give you our studies where we show that, which we called our barriers to care study, where we show how many people are lost at each step of the way, how many people don't talk to the doctor. Once they do, how many people didn't get diagnosed? Once they do, how many people didn't get treated? Um, so to be your own best advocate, go in with your knowledge that you learned from AMF and other great sources with some of your symptoms, your headache or your migraine attack frequency, some information, and say, I need to talk about my frequent recurring headaches or migraine attacks. And then have that healthcare professional figure out who's the right person or place to help you. It may not be them, but they may be able to get you started. Um, the other thing I think, coming from a psychologist perspective, is that health professionals are helping professionals. And when they don't know what to do, they get awkward and freeze up and kind of shut it down. And for the first 2,000 years of human history with migraine, or 4,000, because it goes back to the time of the Egyptians, we didn't have a whole lot of treatments. And so healthcare professionals didn't really know what to do. They had limited options, and I think one of their defense protective responses was, I can't help you anymore. There's nothing I can do for you. I've tried everything. And people were really suffering with, as we all know, a painful, unpredictable, debilitating experience that was wreaking havoc with their lives. And I think some healthcare professionals just didn't know what to do. And so instead of saying, I want to refer you on to someone who might know what to do, or even just taking the moment of kindness and humility and saying, you don't know more, I don't know how to help you, I think that people would get kind of blamed. And this went beyond migraine. This happened in a lot of invisible diseases.
Mhm.
It happened in a lot of women's conditions. Let's think fibromyalgia, Crohn's disease, irritable bowel, all sorts of mental health diseases. All of these kind of invisible, not so easy to diagnose always, and definitely not so easy to treat diseases were stigmatized. And the more that we understand the genetic predisposition, the scientific pathophysiology. We know what's happening with various neurotransmitters in here. We know what nerves are activated. And the more treatments we have, the more empowered all of the healthcare professionals are to help. And they get more excited and involved. And we're seeing that in the past 5, 6, 8 years with all the new pharmacologic and non-pharmacologic treatments. We're seeing more healthcare professionals want to learn, come to our continuing medical education programs, prescribing more, getting more involved, and even learning the lifestyle and the non-pharmacologic techniques, the neurostimulation, the behavioral techniques. So I think we're seeing a good turnaround. But if you have felt ever or currently brushed off, unbelieved, or unsupported by your healthcare professional, you're in very good company. About a third of the people surveyed around the world said the same thing.
Yeah, that's, I think that's so reassuring too, because I think people may leave that. Let's say, worst scenario, you've got your at home, your loved one or your partner, spouse, whoever is kind of like they're already kind of like, oh, really? Like this seems to be more, something else. And then you go to your doctor and they're like, yeah, I've done all I can do. I can imagine that that statistic is probably quite high as well. And so then you're just like, so today it's so great for people to hear you say, we see you, we hear that. That is something that's a reality. And so then what can someone do? You talked about saying to the doctor, hey, I need to raise my hand. I do really need to see what's going on with my headaches. Is there anything else they should do to help get the best care from their, how can they more advocate for themselves? Anything else?
Absolutely. Well, they're already listening to this program. So they're already involved with AMF and other patient advocacy organizations that give good scientific information. You can print out a checklist or a questionnaire from the AMF website, like the ID migraine, say check, 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 show that to your doctor. You can print out some information about some kinds of treatments, show that to your doctor. Also, a lot of people are not never consulters. A lot of people are lapsed consulters. A lot of people listening may have talked to their doctor 10, 20 years ago, maybe when they were a teenager, a young adult. And so they may have had a history and even bad experiences with side effects or medications that didn't work. Jot that down in a very short sentence, just a couple words about what you have tried already, because you may not be starting from zero. I'm betting most people listening aren't. Give them your history, kind of make their job a little easy for them with jotting down some pertinent information, and then say, are you the person to help me, or do I need a referral to someone else to help me? But don't give them the option that no one's going to help you. Either it's going to be them or someone else. Who do we want
I
it to
love
be?
that. I was actually going to ask you for verbiage on what's the right thing to do to say to get them off the hook, if you will, because I think people, like you said, I think people assume how could they not understand headaches? Wouldn't that be like in 101, the first year of school?
It's
And this
not.
is so much, yes, it's so much
It's
more
not. There
complex.
has been traditionally a tiny, tiny, minuscule amount of education in medical school or residencies that are not neurology or headache devoted to headache. There's
Yeah.
very little. That's something the American Headache Society, National Headache Foundation, American Migraine Foundation have been lobbying towards. And we've even created at the American Headache Society educational courses for residents that are free. National Headache Foundation's been doing great work. So we're trying to get out there. But no, traditionally it wasn't out there. And if someone trained 20 or 30 years ago, they only had a couple treatment options. They wouldn't really know about a lot of the new treatment options. And there's so much that a general healthcare professional has to keep up on. It's hard to keep up on everything. One interesting thing is that when you see a neurologist or a headache expert, about 40 to 60% of headache experts have migraine themselves,
Wow.
and about 30 to 40% of neurologists have migraine. So it's much higher than the general population. So there you are talking to people who either have experienced migraine or they might have a family member with migraine. Um, but I think at that broad primary care level. And it might be that you see a primary care professional, internal medicine, family medicine, or a lot of young women see primarily an OBGYN as their main point of health contact. And OBGYNs do hear a lot about headache and migraine, but they've got a lot to know, and this may not be something that they know a whole heck of a lot about, even though there is a lot of interest in all of those groups in keeping their healthcare professionals up to date. It's just a lot to do. So
Yeah.
I think going in with a little bit of information yourself is the right thing to get it started.
I love that. I love that. And then if you're someone that's not really great at speaking up for yourself at a doctor's appointment, do you advise that they take an advocate with them or a family member with them as well?
You can start with that. A lot of times when you check in to a lot of medical appointments using a MyChart or an online portal, a lot of times they'll ask your main reason for this visit. You can write it right in there. You could go in with a questionnaire printed out from the American Migraine Foundation or AHS or NHF website, maybe the ID migraine, something fast and easy, and just hand that over. And
Yeah.
that might help. And absolutely bring anyone you have, a friend or family member who would like to speak up with you if you're a little more hesitant. Is absolutely helpful. And it's always helpful as well to have a second set of ears listening to the medical advice, listening to what you heard is always helpful.
Well, and sometimes don't you think too, we're so exhausted as patients if we've gone through this and haven't felt heard. We finally got an appointment, we get in to see the doctor and they're rushed, they're busy, they've got that questionnaire to go through. I mean, you painted that so beautifully. And if you don't have your loved one to go, hey, hold on, he or she have missed 10 of our kiddos' baseball games in the last three
Yeah,
months please help us get our life back under control with the pain she's feeling. Like you almost sometimes need somebody else to go, no, no, please help us get to
yeah.
this next phase.
I love that. I
Yeah,
love that. The other person who can be helpful is in a lot of medical visits, you will see a medical assistant before the physician or nurse practitioner or physician's assistant. That person maybe will take your vitals. That is a great person to tell, I really need to talk about headache or
yeah,
migraine.
yeah, that's
I
great.
love the example you gave. That disability example is very powerful. She's missed 10 of our son's baseball games. I missed an important presentation at work last week, and it's a big deal. I'm a teacher, and I've maxed out my amount of missed days for the year, and my job's on the line. Give a very short example of why this matters in your life.
Yes.
That is incredibly helpful. And in a study by Doctors Holmes and Lipton, they found that when doctors heard a example of a disability like that, they were much more likely to prescribe appropriate treatments and to
Mm,
take it more seriously.
yeah. Yeah, because it just doesn't sound like, oh, I'm tired of my head not feeling right. It's
Mm-hmm.
this is how much it's impacted my life. Well,
Mm-hmm.
Dr. Buse, do you have any closing words of hope for people who are watching? You've given some fantastic tips. Any thoughts as we close up?
This is a time of all hope. You have all the hope out there. The last 10 years have been a renaissance in our science, our treatment developments, the pharmacologic and also the non-pharmacologic. Remember, you can always add in non-pharmacologic like neurostimulation, biofeedback, cognitive behavioral therapy to pharmacologic treatments. Um, if what we currently have is not working well for you, and some people listening have really tried a lot, scientists are looking at even more new targets to help even more people. So, our last target was the calcitonin gene related peptide, CGRP. We have new targets under investigation. So, new work is underway. So, no one should lose hope. And everyone should also remember that that short list of important lifestyle modifications can make a big difference for everybody. Get your restful sleep, stay hydrated, try and move. And we can't always avoid what happens to us, but try and manage the stress of the busy life of someone with migraine. So, this is a great time for hope. You should have every reason to stay hopeful. Migraine is not your fault. It is a neurologic disease, it is a genetic predisposition. It's been with us since the time of the Egyptian pyramids were built. So, do not take this on yourself. You have no reason to feel guilty, embarrassed, or stigmatized about it. But if you do, know that you are absolutely normal and you are in good company. But let's just work on getting your appropriate diagnosis, your best treatment, so you can live the life that you want to live.
I love that. I love that. And I have reminded people during each of our lives that we also have an online closed support group. It's called Move Against Migraine. It's free to join. We want people to have a place where they are frustrated and maybe they don't have a support system at home, or maybe they don't have a friend or boss or someone who is understanding. Maybe they also have tried 20 medications and their doctor's not hearing them or it's not working. That's a great place to not go in and criticize them, but to say, let me see what people have tried. Let me take this back. Or it also does give you hope and give you feelings of I'm not alone in this. So
Not
we'll put the
alone.
link to that as well. We'd love for people to continue joining that. Dr.
You
Dawn,
mentioned the workplace, and I know we're going to wrap up, but I want
oh,
to also
oh, please.
remind people in the workplace and at school, you have legal rights and protections under the American with Disabilities Act. There are all sorts of accommodations, depending on what type of work you do, where you do it, or where you're at school, that can make a big difference, and you
Yeah,
are legally protected. So it might be talking to HR. If you're at work, it might be talking to your boss. It might be talking if you're at school, going to the Office of Disabilities. But there are a whole range of accommodations that can be very helpful. And AMF has some great information and talks on that. I have some talks on that as well. So remember that there are things and ways to help you succeed so you don't have to feel like you're fighting this fight alone.
Yeah, yeah, absolutely. That's an absolute fantastic plug. And I think it's so important because they're afraid it's going to affect their work and they're afraid of what it could do to their potential for moving up. And there's things to do that some of them are small fixes and it can make a huge impression.
Right.
So,
We're in the middle of summer as well, if you're watching this live. And if you have a child going off to college, or if you yourself are going off to college or back to school, the beginning of the year is the best time ever to document your needs and seek your accommodation so you can get those in place and have the best school year possible.
yeah, absolutely. Well, Dr. Dawn Buse, thank you so much. Thank you to everybody watching. We have absolutely loved doing this. It's going to be hard when June's over because I'm also learning so much in the calls. Thank you for your time and thank you for just your heart and your patience and love for our families and patients. And we just hope you have continued success in your work because that's important to our whole community. So thank
Thank
you.
you so much. Thank you to everyone. Happy Migraine Headache Awareness Month,
That's right.
everybody.
Happy MHAM. Thank you. Have a great day.